Middlesex Hospital Radio Service, and now a platter from Mr. Russ Conway.
Good morning. I'm the phlebotomist.
Eh?
I take blood samples for the doctors.
Oh, right. Here comes the vampire. Did you listen to that Hancock's half hour on the wireless last night?
No.
A pint? That's nearly an armful.
Yes. I think you'll find that things are a bit more sophisticated than that in the NHS nowadays. Cigarette?
Thank you.
In this dirty old part of the city where the sun refused to shine, people tell me there ain't no use in trying. We gotta get out of this place. If it's the last thing we ever do, we gotta get out of this place. Girl, that's a better life for me and you.
I can walk. I can walk.
On, we're nearly there.
You've gone alone. You're better off without me. I'm just holding you back.
Not leaving you, Flynn. Come on.
I'm so hungry.
You've only missed breakfast.
And supper last night because I got stuck in casualty.
No, it's only 2 meals.
Yeah, and lunch yesterday because I got stuck in theatre. Watching Mr. Ron botch up Mr. Clifford's circumcision.
I heard he made a right dog's dinner of that one.
Yeah, well, at least the dog got some dinner.
Come on, Flynn. You'll just have to hang on until lunchtime.
All right, Docs. What the...
Arrest team to Conrad Ward, arrest team to Conrad Ward.
Duty calls, Flynn.
I can't. I'm too hungry. I'm too weak.
Come on. Where the hell is Conrad Ward?
Sid, where's Conrad Ward?
Follow me, lads. Let's burn rubber.
Oh, I've got a stitch.
It's at the far end of this corridor.
Mr. Chaplin.
Give us your scooter, Sid. Are you sure you know how to drive one of these things?
No, but now's the time to learn. Hop on, Flynn.
I'll be dashing right behind you.
I'm the phlebotomist.
Oh, here he comes, the vampire.
I've just come to take some blood.
Just a little prick with the needle, eh? Did you see that Tony Hancock on the goggle box last night?
No.
A point? That's nearly an armful.
Give him oxygen, now!
Where were you? I pronounced him dead 5 minutes ago. You felt no pain, unfortunately. See you in theatre later. Nice metal skateboard on a stick, Flynn.
How inconsiderate is that? Just dying after all the effort we made to get here.
That's patience for you, Flynn. Selfish to the very end. But all is not lost, my hungry house surgeon. Is that a basket of fruit I see before me?
Oh, no, I couldn't eat. Not from a dead man. I'll wait for lunch. Oh, maybe just a little starter. It's an aromatherapy candle. Am I too late?
Yes, Reverend.
I could still save him. These hands can heal and stitch and cut and slit and slash.
No, you're too late.
Did you crack his chest open from here to here? Did you spread his ribs apart? Did you place your hands around his heart and pump and pump and pump?
Yes, we did all that. He's gone to a better place.
Intensive care.
No, the eternal care unit in the sky.
I don't understand. He's with Jesus now, Father. Jesus? You know, Father, Son of God, died on the cross. Died on the cross? I could save him too. Come on. I could. I can do so much more. It's good. It's nearly toast.
Soon be lunch. Hasn't your stomach got a volume control or something?
I think my stomach walls must have ears. It rumbles every time someone mentions lunch. See?
Relax, Flynn. 2 hours' time when the canteen reopens for lunch. All your problems will be over.
Strawberry, red chili, tomato. Oh, red chili.
Mr. Hodge?
Yes.
I'm Mr. Gray and this is Mr. Piper. We're from the NHS Food Inspectorate. We have a statutory order to close this canteen down immediately.
Why?
Infestations of maggots and rats.
Rats?
Show him, Mr. Piper.
And your point is?
And finally, we have Mr. Renshaw with staphylococcal cellulitis. He's due to start on his new antibiotics today. So that's it. The ward round is finished and the canteen opens in 5 minutes.
Good. Time for lunch.
Señor Clifford, estoy preocupada que su puntadas tienen una infección.
Who's this, sister?
Juanita Gutierrez. She's one of the batch of nurses they've recruited from Spain.
Really? Welcome to England, Jacinta.
Thank you.
The NHS is very glad to have you here to help us.
Thank you.
When did you start?
Thank you.
You don't understand a word I'm saying, do you?
Thank you. Señor Clifford, Señor Clifford.
Oh, yes, we must see Mr. Clifford. He had the circumcision yesterday.
And his wife is not happy with the result.
I've already told him, staff nurse, we can't make it any bigger for him. Now, to lunch.
No, sir, the stitches do look a bit infected.
And he does have a very dicky heart, Mr. Ron.
Dicky heart?
The man's a cardiac time bomb, sir. Several heart attacks in the past, and he even survived an arresting casualty last year.
Oh, he was the one, was he? Oh. Pair of gloves, please, sister. Sure. Come along.
Hello, Mr. Ron.
Just going to have a look at your operative area, Mr. Clifton. Now, you students must learn to show patients that you are completely comfortable discussing and examining all areas of the body, including the genitalia. And remember, there is no subject or sight that is too shocking or repulsive for a doctor, right? Thank you, staff.
Does that look right, Doctor? It shouldn't look like that, should it?
It looks perfectly acceptable, Mr.
Clifford.
Clifford. Yes, I think it's healing very nicely indeed. Come along. Quick! Write him up for some antibiotics before the damn thing drops off.
Yes, sir.
You know, that sort of infection is usually the result of poor surgical technique, Noble. Who did it?
You, Mr. Ron?
And sometimes it's just plain bad luck. Right, time for lunch. Yes, you will clear away those students, won't you, sister? Thank you so much.
Right, I'm off to the canteen.
Not so fast, Flynn. You've got to give Mr. Renshaw his new IV antibiotics, ampicillin.
Why can't Judy give them?
In case the patient has an allergic reaction, the first dose of an IV drug must be administered by a qualified doctor.
Qualified doctor?
Yes, you do remember qualifying, don't you, Dr. Flynn? Second attempt?
Right, fine. Right, Mr. Renshaw, I'm just going to give you a first dose of new antibiotics. Now, are you allergic to ampicillin?
No.
Are you sure?
Yes.
Phone a friend, final answer?
Yes.
Right, here we go. There, all done.
Is ampicillin the same as penicillin? Because I am very allergic to that.
Oh, shit.
It's okay, Doctor, I feel fine.
Oh, he's gone into anaphylactic shock. Adrenaline 11000 IM stats, quick! Adrenaline now, please help! Oh, quite tricky things, these files. Need to get the right leverage. How do you open these bloody things? Right. Here we go. What's wrong? Why isn't he coming round? Give me the next dose.
If I may, Doctor.
Did I faint?
Yes. It's very hot in here, isn't it?
Everything's fine, Mr. Renshaw.
Julie, how come your injection worked and mine didn't?
Always examine the patient, Dr. Flynn. You injected his artificial leg.
I'm the phlebotomist.
Here he comes, the vampire.
I've just come to take some blood.
Just a little prick with a needle, eh? A pint? That's nearly an armful. Huh?
Hola.
Hola.
That Juanita seems very nice. She's from Spain. Good Catholic girl. My mother would be pleased.
Why?
Well, we could go to Mass together.
Nice.
Have you had a chance to talk to her?
No, her English is rubbish. Otherwise, the things I could tell her about you.
Really?
Dr. Flynn. He's hard-working, dedicated, caring, failed finals.
Oh, what?
Gave a patient a tension pneumothorax, got sectioned under the Mental Health Act, slept with a granny, killed a patient with maggots.
That's all in the past, Judy.
And more recently, nearly killed Mr. Renshaw.
Nearly killed? I saved him.
No, Dr. Flynn, I saved him. You were too busy treating his woodworm.
Yeah, well, you learn by making mistakes.
Well, you're certainly learning an awful lot.
Yes. I've learned you probably don't want to join me for lunch.
What's that noise?
What noise?
A sort of blobble, blobble, blobble noise when you said lunch.
I've not eaten since breakfast yesterday.
Oh, poor Dr. Flynn. Still, at least that explains about the vial of adrenaline.
What?
Why you couldn't open it. You were obviously in some sort of hunger-induced state of weakness.
Yes, yes, that's right.
You know, Dr. Flynn, I would actually love to join you in the canteen.
You would?
But unfortunately, the canteen's just been closed down.
Closed down?
Hygiene reasons. Looks like we'll never, ever have the chance to have lunch.
How am I going to get some food? I'm starving.
Just get some crisps from the League of Friends shop.
Yes.
Assuming you've got the strength to pull open the packet.
All right, Doc. Sid, where's the League of Friends shop?
It closed down. This hospital ain't got no friends.
Oh, but Judy said... Oh, forget it. So what's with the wheels?
The management said they thought I was too slow. Can you believe that? So I bought this.
That's great, Sid. Sid, you haven't got any food on you, possibly.
You may be in luck, Dr. Flynn. I think I've got a sausage roll you can have.
Oh, great.
I buy 'em hot. I'll keep 'em warm down the front of me trousers. Oh, don't worry. The hairs are full of protein.
Oh, right.
Mustache.
Right, let's go back to the very basics. Frozen, defrosted, raw meat, cooked meat, fresh, rotten, dead, alive.
Now, my dear, although you will be fully conscious during your operation, you will feel no pain. I've carried out a regional anesthetic block on your left leg. You will lose sensation and then muscle power. I will now test for its effectiveness. Feel this?
Ow!
Feel this?
Ow!
Feel this?
Ow! Just a minute, that's not the leg you anaesthetised.
I know.
Dr. Flynn, I hear Nurse Judy saved your bacon this morning.
Bacon? She's got bacon?
I meant about what happened to Mr. Renshaw.
Oh.
Flynn?
Oh, he just had a funny turn.
You're not talking to a bloody relative. What really happened?
I gave him some ampicillin. He was allergic to it and he went into anaphylactic shock.
Oh, my God.
So, you just gave Mr. Renshaw a shot of adrenaline to bring him back to life then, Flynn?
Sort of. I missed.
You injected his false leg, didn't you?
How did you guess?
There are no new mistakes in medicine, Flynn. Just the same old cock-ups again and again. Sort of medical Groundhog Day without the happy ending.
Excuse me.
Quiet! This does not concern you!
Now tell us the best bit, Flynn. About the vial of adrenaline.
What about the vial, Flynn?
I couldn't...
Couldn't what?
I couldn't get the top off. Staff nurse Judy had to do it. Right, that's it. You've all had a good laugh, have you? I'm so fed up with this place. I'm so fed up with this job. Stop the lot of you. I'm off.
Me too. Oh!
Nice regional blog.
They're full of protein, apparently. You managed to get lunch? Oh, come on, Flynn. It's not that bad a life being a doctor.
I don't want it to be my life.
Think of the feeling you get sometimes, the adrenaline rush.
Adrenaline is not the best subject to bring up at this present time.
Ah, yes. Look, we got you this. From all of us in theatre. Say sorry about earlier.
Pizza?
Yeah, they've just started up. And they deliver to the hospital.
I'll ring them now.
No, they don't open until 7.
Oh, that's 4 hours.
And the other present.
Coffee?
Nope.
Chocolates?
Nope, better.
Adrenaline?
We thought you could practice opening the vials. You know, for the next time.
It's the best present I've ever had.
Here he comes, the vampire.
I've just come to take some blood.
Just a little prick with a needle, eh? A pint? That's nearly an armful.
Right, Flynn, there are 2 ways to open these babies. First, the girly way. Wrap the vial in your white coat and snap the lid off. That way, if the end shatters, you don't get any nasty glass splinters in your hand.
That happens?
Yep. But the manly way is like this.
That's just how Judy did it.
Your go. Excuse us. The boy's got to learn. Maybe it's time I let you in on a little secret. Use the spot.
Use the spot?
Yeah, usually there's a spot on the neck of the vial. See? Now that marks the weak point. If you lever over that, it snaps off nicely.
Oh, yes, yes, yes!
This could be a new start for you, Flynn. A relaunch.
He said launch, not lunch.
Come with me, Flynn. Got to get that stomach some food. Oh, sorry, Flynn. Looks empty. Oh, hang on. They're at the back. Marathon bar.
Oh, chocolate and caramel peanuts is a complete meal in one little bar.
30 pence. It's out of order. Dr. Flynn, I'm so sorry for your loss. Right. Stand back. That usually works.
Right, let's look in the fridge.
Now that is for my own personal use.
Good.
Laparoscopic keyhole surgery, Flynn. The greatest technological advance in surgery for 30 years. Won't reach. Right, that calls for the colonoscope. Flynn, turn the machine around. We're going up the backside. Now, where's that lubricant?
What you doing, Doc?
I'm trying to get that chocolate bar.
What, you still hungry? Not that sausage roll I give you?
Just a bit peckish, Sid.
Hang on, I might have some more food down here. Now, I'll try round the back.
No, can you get this thing working, Sid?
Stand back, gentlemen. See why they call me the Machine Whisperer. Come on, lovely. Go on, daddy.
Results, Sid?
I've always had an affinity with mechanical things. That's why I loved my little scooter so much.
And where is it, Sid?
I sold it to a patient. He was going home today. He waited 4 hours for an ambulance. Seemed a decent thing to do.
Well, sometimes when you love something, you just have to let it go.
Yeah, but plus the fact the back wheel was working loose. Things are bleating death trap.
I can walk. I can ride.
Laters, dudes.
Oh, come on, Flint. Time to enjoy your marathon.
Do they still do marathon bars?
No, they changed the name to Snickers.
How long ago?
1991.
And not only that, you put raw meat next to cooked.
Diarrhea.
Good.
Bowel obstruction.
Very good.
Manuel disimpaction.
Nearly.
Dr. Flynn?
Judy, Juanita asked if I could teach her some English medical terms.
Bloody stools.
The phlebotomist wants you.
Oh, momentit. Hello.
Any blood you need taking?
Yes, on Mr. Renshaw. Oh, but just the armful. Is he a bit...
He's completely burnt out. Do you know, it's his last ever day today. He's been medically retired before he turns into another chaplain.
Right.
Dr. Flynn.
Oh, I better get back to Juanita.
Did you manage to get any lunch? Obviously not. Why don't I ask Terry to bring you a nice snack?
Oh, great. That's really nice of you, Judy.
Well, I don't like to think of your manly appetite not being satiated.
Anal warts.
I'm just teaching her some of the common words she might hear from a doctor.
Premature ejaculation.
Mr. Renshaw.
Here he comes, the vampire.
I've just come to take some blood.
Just a little prick with a needle, eh? A pint? That's nearly an armful.
It's obvious you have no idea of the basic rules of food hygiene.
Oh, forget it! I resign. I've been offered a job with one of the most prestigious centres of Epicurean gastronomy in the area. I declined because I thought my work here was appreciated. I was wrong. I quit. Forgot this.
So, how are the lessons going with Juanita?
Oh, very good. She can now say pancreato-duodenal-cholecystectomy.
Great.
And I bet you didn't know I have a GCSE in Spanish.
You didn't fail it.
It's really nice of you, Judy, asking Terry to bring me a snack.
You know I worry about you, Dr. Flynn. I'm just not very good at... What I'm trying to say is... Oh, it's no good. I just haven't got your language skills, Dr. Flynn.
Oh, just speak from your heart, Judy, via the lungs and vocal cords.
Just because I treat you one way, it doesn't mean I don't feel another. Things aren't always what they seem on the surface. There are things much deeper.
Like some abscesses. Small heads, but when you drain them, they're full of pus.
Dr. Flynn! What I'm trying to tell you is that I don't think you should spend so much time with Juanita because I really... I really... What's that?
Judy, he was saying...
Flynn, come quickly.
But she was saying...
It's Mr. Renshaw, that phlebotomist. I don't know what he was thinking of. He's cracked.
Oh. The acupuncture helping at all, Mr. Renshaw?
Hello, is that the Gleaming Tower of Pizza? Could I order a delivery? 2 garlic breads with cheese and the abattoir meat feast with extra pepperoni.
What did you bleep me for, sister? I'm on my way home.
It's Mr. Clifford's dinkle. It's looking even worse than this morning. Mrs. Clifford would like to talk to you about it.
What's it got to do with her? They're married, for God's sake. She won't be touching it.
Well, if you'd prefer her to make a formal written complaint.
I better have a look at Mr. Clifford's thing first. Nothing to worry about, Mr. Clements.
Ay, mi Dios.
Healing nicely. Nurse Jacinta here is going to put a new dressing on for you. It's looking really good. Right, we'll talk to his wife and then I'm going to call my lawyer.
£19.20. Deliver that to Dr. Flynn on Hannaford Ward.
Yeah. Arrivederci.
And you did ask for the garlic bread with cheese?
Yes.
Juanita wants you, Dr. Flynn.
Oh, no, she doesn't. She's got a boyfriend in Spain. Pedro. He's a pilot. So, Judy, I'm available.
Good, you can talk to Juanita about Mr. Clifford then.
No, us. You know, earlier, you were saying.
Was I? Oh, I can't remember.
Dr. Flynn.
Hola.
Señor Clifford, su corazón ha dejado de palpitar.
Flynn?
Mr. Clifford, his organ, his large pumping organ in his chest, his large pumping organ of his chest.
Heart?
Sí, su corazón ha dejado de palpitar.
His large organ, his heart has been taken away, taken into custody by the police.
Arrested?
Sí.
So Mr. Clifford's heart has arrested.
Sí.
Shit! I told you he was a cardiac time bomb. Judy, crackle gas man. We'll get the arrest trolley.
Where is it?
Judy?
TV room?
Now, let's play The Weakest Link.
Sorry, we've got to borrow this trolley.
Where's the defibrillator? I need it!
Here we are.
Is that the defibrillator?
No, popped out for Dr. Flynn.
Where's the shocking machine of the panels? Is this it?
Get me the thoracotomy saw and make it razor sharp.
What is this madness? Oh, good, now it comes.
Pizza for Dr. Flynn.
What? At last.
Right, what we got?
2 garlic bread with cheeses, 1 abattoir meat feast with extra pepperoni.
Looks like runs up SVT.
Okay, keep the compressions going.
May I?
No, Reverend. Maybe later. You take over, Flynn. Charge?
£19.20.
Flynn! Pay the man! Oh, could someone get the money from my pocket? Judy? I'll do it.
Dr. Flynn?
Oh, that's a sausage roll. Terry! Other pockets.
Here, keep the change.
Thanks. Here's some leaflets. Ciao.
Let's see the trace.
You're losing him.
Right, this is it, Flynn. He needs adrenaline now.
Now, Flynn!
Use the spot.
Yes! Yes, yes, yes!
Actually, no, Flynn. Don't bother. He's gone.
But I opened the vial.
Time of death, 7:05 p.m. Cause of death, acute myocardial infarction. Perhaps you'd like to say something, Reverend.
Of course. Lord, we thank you for this pizza we're about to receive. Amen.
So, you see, your husband's post-operative infection was just one of those things, Mrs. Cliffface. Nothing to do with poor surgical technique at all.
And we do know how you worry about his weak heart, Mrs. Clifford.
Yeah, but rest assured, your husband will only ever enjoy the highest standards of clinical care whilst he's on my ward.